I am a master's level social worker. I work for Care Wisconsin, which is a family care, long-term care program held under Medicaid. The population that I work for are adults with disabilities such as the frail elders, developmentally disabled, and physically disabled.
Okay. Do you believe seeking professional mentors in your field is valuable? Why or why not?
As a new social worker or coming into a field in the human service field, having new mentors is actually a way to help guide you into your profession. A lot of the mentors have already been in the field for a long time, so having that support is actually valuable because you're able to be educated and guided into your role.
How do you recommend new professionals develop their skills, expertise, and identify in their field?
Um, to start off by getting some sort of related experience, whether it be through volunteer or a position or a paid position. So for example, when I first graduated with my bachelor's, I did not go into the field of social work right away. I
Mm-hmm.
actually started working for a administrative assistant temp agency, and then during that time, I volunteered at the food pantry for a whole year, just to build my resume and to give back into the community. Just because a lot of um, social workers or human service workers, they tend to give back to the community, and I feel like that was my way of giving back. So, and then while I was finding a job, I that's what I did during that time.
Okay. What are the basics for clear and effective communication to various groups and individuals?
Having a professional tone when you talk to individuals, whether it be through like face to face or through emails. Especially through emails, you want to make sure that there's no grammars or any errors that on there that should be fixed. In person, it's a little bit harder, but through email, at least you could reread it a few times before you submit the email.
Um, and what are the most effective strategies for building successful professional relationships?
Um, just establishing good rapport with your colleagues, not only with the clients that you work with, but with your colleagues, the organizations that you're working for, the providers that you're working with, and upper management. Um, just because you never know when those personnel or colleagues will come in handy. A lot of the times they are your resource. So sometimes if you're working on a case that you're not familiar with, by reaching out to the providers or to your colleagues, they're able to educate you.
Okay. Describe how you build professional networks and engage in your community.
I think it starts off simply just by being involved with the community. So, such as volunteering in the community, I was able to network with other individuals that work in the human service field. Um, a lot of like, I want to say a lot of you. You get a lot of, I guess, just professionals that work in like the food pantry. Even though it's just food pantry, you have like social workers that are in there or human service workers that are in there. So I start by volunteering, getting out there, and just introducing yourself. That's how you network. And then when you're
Mm-hmm.
actually working, a lot of the times you'll just meet people along the way. And especially if you tend to work in the same city or the same region, you learn to be familiar with providers and like other workers that have similar roles as you, and you learn how to just kind of keep in touch and acknowledge them when you see them. And then who knows, maybe they could be your bridge to have a new role or a new position, or maybe they could be the one to introduce you of a new company that could better fit your professional goals.
What should be considered when forming a team, task group, committee, etc., to work on a common goal or on a common purpose?
Sorry. Can you repeat that one more time?
What should be considered when forming a team, task group, or committee to work on a common goal or common purpose?
Who anything that's or anyone that's related to that particular goal. So I guess an example would be interdisciplinary team, which is kind of like the what you call a care team that helps to works to resolve a goal or works together for a member or a resident or a patient. That's what you those are interdisciplinary teams. So when you are considering the group, you want to consider who's going to be affected or who's how that person is going to affect the individual that you're working for, such as the client. So I guess to give you an example, let's say someone is in a nursing home and this person is going to be discharged to go to an assisted living instead of an apartment. Who should you consider? So obviously you want to consider the person that's moving, the client, so, and then you will consider him or her. And then if they have supports that at home that help them, you might consider a family member or someone that represents them legally, such as a guardian or a power of attorney. And after that, you want to consider how is this person going to get discharged? How do you get involved? Well, you're going to have to involve the nursing home that they're staying at, along with the doctor, because the doctor needs to release them. And if they're going to an assisted living, you want to consider, okay, who's going to um, assess this person, who's going to assess this person. So you want to include the future residential provider, um, and maybe the case manager that's involved and maybe providing the financial resource or financial authorizations. So those are just some of the main individuals. I've seen other individuals include like day programming, meaning if they go to like a program for like adults during the day, most of the times they have like a case manager, and then you would include them as well, just because Monday through Friday they're at a day programming. So the day program can kind of explain to them what they see there, and it's just nice to have everyone that's working with this individual be involved.
Okay. Comment on professional work stress, burnout, and your suggestions regarding stress management.
Obviously, in the human service field as a whole, there's a lot of burnout, especially at the very beginning. At the very beginning, I think when you have the goal to help those that are less fortunate, you want to do as much as you can. And sometimes people tend to do it all at once. And then you dedicate a lot of your passion and desires into helping this population. But the truth is, you can only help them to a certain point. So you do what you can, especially if you are on a salary position. You do what you can, and then you prioritize. And then you have to be fluid and be flexible and say that whatever is not done, as long as it's not urgent, you have to let it go to prevent burnout. And as far as burnout, you kind of have to consider how to take care of yourself. So after work, how do you take care of yourself? How do you release stress? Like for me in particular, every morning when I do my makeup, I like to listen to a motivational video to start my day. I don't listen to the news in the beginning. When I go on Facebook or social media, I try to stay away from any news about things that are going on in the world, just because I hate to start off my morning that way. That's my way of self-care and to not be so stressed right away in the morning. Just because I know that going into work, it's going to be stressful already. So, so I try to stay away until I get into work. And that's my way of taking care of myself and then being physically active. Stress. So basically, to sum it up, you have to prioritize what you need to for work and know that you cannot finish everything that needs to be done. And some of them you have to learn to prioritize by due date or by urgency, level of urgency, and do what you can with the time that you have. And then whatever is not done, know that as long as it's not urgent, you can always get to it the next day, because this list of to-dos will be endless. Because on your caseload, you're going to have between maybe 30 to like 50 people that are on your caseload. So caseload are individuals that you're working for. So if you're going to have that many people that you're helping already, obviously you can't get it done in just one day. So that's where you have to prioritize. So learning to prioritize and accepting the fact that, okay, it's 4:30 or it's 5, I can't get it done, so tomorrow I'll get to it. And you have to know that, okay, it's not urgent, so I can push it to the next day or when it's closer to the due date. So yeah.
That's a lot of casework.
Well, no, but
Yeah.
you get used to it because
Yeah.
everyone that's on your caseload,
Mm-hmm.
they're not high needs. So I
Mm-hmm.
have like 44 people on my caseload that I have to help out and case manage
Mm-hmm.
long-term care. And out of all 44 of them, only like maybe 5 or 6 of them requires like weekly interaction or like even every other day interaction.
Oh.
Sometimes I don't even hear from the individual unless if I call them once a month to see how they're doing. That's what we call monthly collateral contact. And unless if I don't call them, I don't hear from them because they're so stable. So just because you have a high caseload doesn't mean that you have to work with all of them. It's just most of them are
Mm-hmm.
stable anyway. It's just some of them requires more attention than others. But most of them are good.
Yeah, that makes sense. Um, any words of wisdom for students entering the professional world?
Never give up on finding a job in the field. Just because I've had um, colleagues or colleagues from like college that decided to give up because they couldn't find a job in the market. Considering how competitive it is a competitive field. But if you don't give up and you keep applying and you keep building your resume and you give back to the community, and as long as you keep trying, you will find a position. For anyone that's looking for a position in the community, um, don't give up, keep trying, but at the same time find a population that you know that you could connect with and you can work passionately with. That way when you go to work, it's not like you're always looking for it to be Friday. Even if it's like a Monday, Tuesday, Wednesday, or Thursday, it's just another day. It's not so dreadful. If you hate your job, you're gonna be counting the minutes and it's not worth the pay.
Right.
Okay.
Okay. Thank you.
Sorry. Hopefully that makes sense.